Good evening, Rina. Right, all of you can type your first name and second name. Number one. Type your first name and second name. Yes. Sangeeta Patel, Ushas Binod. The next person, Reena Chauhan. Very good. Whenever you come, you have to submit your attendance like that. Right. Now write the problems that you're facing in speaking. Your weak areas, your problems, whatever problems are there, you can just mention over there. Write down all your problems related to speaking. Write down all your problems related to speaking. What all problems you're facing. You can just type there. What all the problems that you're facing. Please write them down. Simul Thomas. Write down your name first, that is your attendance. Then afterwards, write down your problems which you're facing. Yes. Yeah. Yes. Write down. Think more. Think more. Write what problems you're facing. I confuse about which kind of words I have to use. Okay. Write down more points. So Grandmaster class, 28 November 2022, Monday. Yes. Speaking card, insulin injections. So here is your card. Role play card number 1. We're going to practice these things. You can share all your problems, whatever you're facing, because we are going to discuss these things in detail. Yes, go through these points. Yes. So we have 9. So 9 minus 2, that is 7 people on board. So that's fine. So I'm just waiting for 3 more candidates. So that Shalu will be the number, out of which 2 are mine. Yes. So, your 60-year-old patient has type 2 diabetes, which has been moderately well controlled by diet, and oral medication until now. So, however, recently the patient's blood sugars have been high. The doctor has decided to commence insulin injections. You are seeing the patient to show her how to administer injections. So first thing is you will start with introducing yourself. This is a medical clinic. So I came to your clinic and you are asking me to come and sit down or whatever it is, formalities. Okay, first thing is you're going to introduce yourself. You're going to introduce yourself. That is the first thing. Okay. So the point, yes. Yeah, that's the number 12. So first point is here. Okay. First point is, so begin the conversation. Begin the conversation. And this is the first step. Step 1. Step 1. Begin the conversation. Write down whatever you want to write there. Write down the conversation. Begin the conversation. Prepare. One by one, I'll be asking you. Okay. One by one, I'll be asking you. So whatever you want to speak, however you want to start the conversation, write down there. Then be ready. When I take your name, immediately you will unmute and you'll speak and close it. Yeah, greeting. Begin the conversation. How are you going? Type it. Type it. Type your conversation. Yes, good evening, Meera. Yeah, Nasra, introduce yourself and your role. Come on, introduce. Introduce, greet, whatever it is. Write some. I don't want what you have to do in a one label. I don't want the labels. Labels are not important here. Write down full sentence. Hello. Good evening. Nice to meet you. Yeah, here is Sangeeta. Hi. Good evening. I am Sangeeta, one of the registered nurses in this clinic. How may I address you? Yeah, very good. So I am correcting this sentence. It should be like this. Hi. After hi, it's an exclamatory mark. Good evening, G capital letter. Good evening, comma, or exclamatory mark. I'm Sangeeta, comma, one of the registered nurses in this clinic. How may I address you? This is the way how you have to write. Okay. This is the way how you have to write. Good afternoon. My name is Steffi Abraham. I am one of the registered nurses in this facility. How would you prefer to be called? Okay. How may I assist you today? Question mark. That's fine. Reena Chauhan, no shortcuts. Good evening. Rewrite this. My name is Reena, R capital letter. I am one of the registered nurses in this medical clinic, full stop. And continuation. Hi, good evening. Yes, how may I address you? That's fine. Question, capital letter. Reena, capital letter. Smita, hello, good evening. My name is Smita and I am a registered nurse working in this facility. How may I help you? Once I take your name, you can start. So those who are ready, the first introduction part, type your name so that the first part, type your name so that I'll call you. Once you are ready, I'll call you. Once you are ready, I'll call you. Then when I call your name, you have to unmute. So those who are opening the video, okay, I can see here if anybody is opening the video, okay, they will be given more priority. I don't want people to be in the kitchen or on the bed or somewhere else. Not now. When you are speaking, that time you have to open your video so that I can see you here. Yes, they will be given more priority, first priority. So if you don't open also, it's no problem. Yeah, that gives you courage to speak. Yes. So write your name and say audio or video. Anything is okay for me. But for audios, Reena Chauhan, raise your hand. Very good. Audio or video? Type there, audio or video. If you come on audio, that's fine. If you come on video also, that's fine. So, yeah, audio, right. So those who come on audios will be given 100%. Those who come on videos will be given 200%. Because when you speak, I can see your facial features and I can tell you a lot more about your presentation. Yes. Fine. So, anybody else ready? Anybody else ready? Yes, Reena Chauhan. Unmute. Yes, can you introduce? Can you start?
Yes, sir. Hello. Good evening. My name is Rina. I am one of the registered nurses in this clinic. How may I address you?
Okay, can you repeat?
Hello. Good evening. My name is Rina. I am one of the registered nurses in this clinic. How may I address you?
Okay. Yes. Now you can mute back. Hello. Okay. Good evening. I am Peter Simon, one of the registered nurses working in this clinic. I am extremely pleased to help you. But before beginning the conversation, let me know how you would be called as and what is the purpose of the visit is, so that we can go on with the discussion. The video is recorded in the YouTube. I cannot write, I cannot show all these things. So go to the video, load them, pause and write down the sentences. How well you can use them, that is up to you. I will give you a number of, with every person, I'll give you an additional sentence, additional style, presentation. Yes, that's good. That's very good. So that is number one, Reena Chauhan. Next is Sangeeta Patel. Yes, Sangeeta Patel.
Yes, sir.
Yes, you can start.
Hi, good evening. I am Sangeeta, one of the registered nurses in this clinic. So, how may I address you?
That's very fine. But when you are speaking tomorrow, there should be a great improvement in this introduction. It should be with great confidence you have to speak, and I should not hear a before your sentence. Anywhere that a should not come, and you practice these sentences. Tomorrow again, I'm going to take a speaking session for you. And when I'm speaking, that R sound should not come. Practice as much as you can. Hello. Please come on in, have your seat. By the way, my name is Peter Simon, and I'm one of the registered nurses working in this medical clinic. How may I assist you? Okay, before beginning the conversation, I would be pleased if you let me know how I can call you and give me the reason for your visit. Next is Smita Kanta.
Yes, sir.
Yes, you can start, Smita.
Good evening. My name is Smita and I'm one of the registered nurses working in this facility. Please come and have a seat. And how may I help you today?
Good. Good. Very good. Hello. Nice to see you here. Please come on, have your seat. May I know the reason or the purpose for your visit to our clinic? By the way, my name is Peter Simon, and I am a nurse, a registered nurse working in this medical clinic. I'm pleased to assist you, but can I know your name and the purpose of the visit, please? And next, anybody, type your name or raise your hand so that next. What about the others? Either raise your hand or type your name so that I can call you. Ushas Binu. Yes, Ushas. You can start now.
Hello.
Yes, please.
Yeah. Good evening.
Good evening, nurse.
My name is Ushas. I am one of the registered nurses working in this clinic. Please be seated. Tell me how can I help you? Tell me how can I help you?
Tell me how I can help you.
Okay.
Tell me is a sentence, not a question. Tell
Okay.
me how I can help you. Or if you remove tell me, then you can say, how can I help you? That's a question. But when you say, tell me how I can help you, it should be a sentence, not a question.
Okay. Okay, sir.
Right. Good evening, gentlemen. Good evening, gentlemen. Come on in. Please have your seat. My name is Peter Simon, and I'm here to assist you today. And let me tell you that I am one of the registered nurses working with this medical clinic, and I'm pleased to help you. What's bothering you and what is the purpose for your visit? And by the way, how may I call you? Yeah, next, anybody else? Raise your hand and type your name so that I can call you. If you don't raise your hand and if you don't type your name, then I have to call your name and you have to speak. So that's it. Abdullah, are you ready for? Yeah, you can raise your name, hand or type your name. Otherwise, you people will be considered as passive participants. I want active participants. I want active participants, please. Yeah. Next. So, second point is confirm the reason for appointment and why he has come. Self-administering injections for diabetes, advice, observation, find out how patient feels about insulin injections. So this is the first bullet point. Yes, get ready. Type your answer. For the first bullet point, type your answer. And once you type your answer, prepare your answer. Prepare your answer, practice your answer, close the mic and speak loudly for yourself. Practice. Then you can raise your hand or type your name or say, I'm ready. Then I'll call you. Yep. Submit your answers, please. The first point, confirm reason for appointment. Self-administration, administering injections for diabetes, advice, observation, and find out how patient feels about insulin injections. So the reason for appointment is Reena Chauhan, capital letter beginning. Do you know about insulin injection? D, capital letter. Ask in a flow everything, not bit by bit. Ask everything related to that together. Okay, Steffi Abraham, you did not speak last time. You just gave your answer. Okay, no problem. You can speak also. Okay, Alex, you're here for advice regarding the self-administration of insulin injections. Am I right? Full stop. Am I right? Question mark. Yes, please. Write down. Prepare your answer. So there are 14 students now on board. Write down your answers, all of you. The second point, confirm reason for appointment. That is, first one, self-administered injections for diabetes, advice and observation. Find out how the patient feels about insulin injections. If I am not wrong, you are here for the self-administrating insulin injections for diabetes. So do you have any knowledge about the insulin injections? Ashley, Alex, did you heard it? Did is already past tense, Alex? Ashley, did is already past tense. Then why did you write a heard? Did you hear? Did you hear? Did you hear? Rewrite it correctly. Did you hear about insulin injections? Did you hear? What do you mean? The question is a little bit vague. Do you know? Do you know? Do you have any knowledge regarding insulin injections? Try to say, did you hear? Improve the sentence. Do you know anything about insulin injections? Okay, Mr. X, your doctor has informed me to teach and demonstrate you about self-injecting insulin, self-administration of insulin injections, spelling mistake, insulins, no E, administration procedure. Am I right? Am I right? You are right. Am I right? Doesn't sound fine. Because you know that you are right. So that doesn't sound fine. Other sentence is okay. Alex, do you have any knowledge regarding insulin injections? Yes. Come on, others. Others. Yeah, then afterwards, once you prepare, try to speak some more. Ne? One sentence, two sentences, not enough. At least 4 to 5 sentences should be there. Every question is 1 minute. If you just write, may I know what you know about insulin injections? Come on, ask 3 or 4 questions and give 2 or 3 pieces of information. The question entirely you ask. The doctor has endorsed me the job of providing education regarding self-injecting insulin, self-administration of insulin injections. In addition to demonstrating the procedure in person. Do you know anything about insulin injections? Let me know if you know anything about insulin injections. Do you have any knowledge regarding insulin injections? Anything you want, you can add to that. Your records and the test results, blood test results, revealed something. What you tell, you know better. Your blood test revealed high glucose levels in your body, which cannot be managed merely by taking medications. After considering all the possible options, the general practitioner has prescribed insulin injections. Because there is no other option which is better than this. What do you think about this proposal? Do you welcome these suggestions? What are your concerns regarding? What do you think about taking insulin injections on your own? I'm going to explain why and how these injections have to be taken, and I will demonstrate it to you. And for the first week, maybe 3 or 4 days, I will be with you, supervising the manner how you are going to take the insulin injections. And once you are confident enough, we will leave you to manage it all by yourself. How does that sound? So write your sentences. Speaking is the name of the game. How you manage is in your hand. If you do not speak properly, you will end up in 3 minutes. So every point is for 1 minute. 5 minutes altogether. 5 minutes altogether. So in 1 minute, how many sentences can you speak? That's it. So cover it up. So first part. So try to avoid taking the name of the patient always. Once you have confirmed, that is the end of it. No need to say Mr. Simon, Mr. Peter, Mr. X, Mr. No need to tell those things. Just you can say, I'm going to demonstrate insulin self-administration of insulin injections. Is that okay with you? He will say it's not okay. Then what are you going to do, Nasra? If I am there, I'll say it's not okay. Then what you will do? You can ask him in a more polite way. So ask in more polite way. First give the sound reason and background, and then ask in a more polite way. How are you going to ask is more important. I will explain you all the reasons why it is extremely necessary for you. After listening to all these things, I believe that you will definitely understand the importance of insulin injections. And then once you give your consent, I will demonstrate the procedure of taking self-administration of insulin injections. So that's it. Yes. So this is the way how you're doing. Anybody is ready? Type your name or raise your hand. Rubina, awesome. Rubina Kausar, excellent. Wonderful. I really like your sentence. It's a length. Very good. Mr. Alex, you're here to understand about how to administer insulin injections. Would you mind to ask, do you have any idea regarding insulin self-administered medication? Please let me know what you think about it. Don't worry, I'm here to help you. I will demonstrate to help you. Whatever, there are grammar mistakes, there are vocabulary repetitions, there are many things. There's active voice, there is I, we, you, personal pronoun, a lot of things are there. But still, I like your style of presentation. That's really awesome. Really fun. So this is what is required for 1 minute. Yes, next. Sangeeta Patel, awesome, wonderful, lovely, lovely. And prepare these tomorrow. I'll call you personally directly on the video and it will be a session, wonderful session, believe me. Believe me, that's really wonderful. What about the silent participants? I will appreciate your active participation because it pains me when you don't open up. No problem, you can't speak now, definitely. I can understand your concern, but you can definitely practice. Practice it. No, you have a lot of time. What are you going to do all day? Practice. Practice. Speak. Go to the mirror and speak 10 times to the mirror. Or else sit in front of your son and just speak to him. He will just laugh, but speak. So the problem is the tongue should be, dancing. Practice, practice. I'm giving you time, practice. At least you are able to, before you were not able to write, now you are able to write. I understand your situation, full stop. There's nothing much to be worried about. You know that you have been DM for a long time. You have a long history. You have a history of diabetes mellitus for almost 3 to 4 years, a considerable time. And your sugar levels cannot, one word, be managed and controlled with your diet and medication and exercise alone. It is high time. Yeah, very good, very good, very good. So it is indispensable, wonderful, wonderful. I appreciate. I really appreciate. Yes. Yeah. That's good. Next. What about the others? Yeah, anybody is ready to speak, you can speak now. If you cannot do now, no problem. Such a spelling is S-U-C-H. Yeah. Right, please. Anybody is ready for speaking, raise your hand and type your name. Okay. Yeah, I am ready. Yes, Sangeeta, fine. Yeah, you can start. Yes, Sangeeta. Yes, please. Yeah.
Okay. I understand your situation. There is nothing much to be worried. You know that you have been diabetes for a long time and your sugar level cannot be managed and controlled with your sugar, with your diet and medication. So it is indispensable at this condition. Otherwise, there is a risk of serious complication of diabetes, such as kidney failure, liver damage, etc. So, to avoid this complication, you must need to take insulin injections. Are you willing to? Are you able to follow this advice? Are you able to follow this advice?
Okay. That's good. That's good. Try your level best. Okay, that's fine.
Thank you.
Then next, who wants to practice next? Type your name or raise your hand. It's okay. You can even read from the paper, whatever it is, because you are now preparing. Okay. So tomorrow when I call you, you have to be on the video and I have to see you directly because many people, they just keep the paper in front and read. No, tomorrow I'm going to ask you. That time I have to see you face to face and you have to look into my eyes and speak. Okay. Practice. I'm giving you time till tomorrow. Yeah. Anybody else? Yeah. So, Smita, Reena, Chon. What about the others? What about the others? Write down your answers. At least write down your answers. Afterwards, prepare if you can. Yeah. Next. Nasra, very good. Very good. Yeah, anybody who is ready can raise your hand. Okay. Reena Chauhan. Yes, Reena Chauhan, you can start now.
Hello, Mr. John. I appreciate your worries, but don't worry. I am here to help you, and your sugar level cannot be managed with the help of oral medication. However, doctor advised to give insulin injection. Is that right? All right?
Good, good. Yeah, next. So tomorrow I'll be calling you people directly. I'll be taking prepare well all these things. Yeah, next. Yeah, Ashley, come back. Okay, very good. Yeah, anybody who wants to participate? Yes. Yeah, anybody next who wants to participate, wants to speak, whatever you have written, you have to speak, you have to present. Okay, now, next point is explore reasons for patients' anxiety, injection process, fear of pain and needles. Oh, nurse. Yeah, Binsimol, do you want to participate? You did not participate. Why? What's holding you back? Is it the fear? Yes, Smita, Kanta, get ready. Who next? Come on. Come on. Yes, next to Ushas Bino, be ready. Yes, Smita, Kanta, you can start now.
Mr. Richard, I completely understand your concerns, and I can see that you are worried regarding the self-injecting of insulin and fear of the needles and the pain. But let me tell you that it is completely very easy procedure, and the pain is very less. Okay, and I will teach you each and every steps in detail, so nothing to worry about it. And you can ask me many questions, whatever doubts you have regarding insulins and the pain and the complication. I will clear all your doubt. So hope does that hope it will help you. Sorry, sir.
No, that's fine. That's fine. That's fine. You be happy. Why should you be sorry? Many people are not opening their mouth. You should be happy, dancing with joy. At least you have opened up your mouth and doing something. Those people who are not speaking, they should be sorry. Why you are sorry? No need. Be proud, be happy, and raise your collar and say, I have spoken something to Peter, sir. Many people don't have the courage to come out openly. Okay. I'm so cool and relaxed, but still they fear. I don't know why. This much support, this much cooperation, nobody gives. But
Yes,
still,
sir.
yeah, next. Who is that next? Ushas Bino. Ushas Bino.
Hello.
Yeah, next is your turn. Yeah. Next, raise your hand or type your name. Anybody else?
Hello.
Yes, Ushas.
Okay. Okay. Today I am demonstrate about you regarding the self-administration of insulin injections. May I know, do you know do you heard about the insulin administration, and let me know how do you feel? And I think you are too much anxious about the insulin administrations. Don't worry. So we will explain to how to injecting the process and how to relieve the pain and relieve the pain and needles. So no need to worry. Everything we will explain for and demonstrate you. Then you will relax about this fear.
Fine. That's really fine. Very good. Very good.
Thank you.
Yeah, next. Who is next? I will not call you because if I call you and you don't respond, I feel very sad. So if you raise your hand, I will give you a chance. And be courageous. If you open your mouth, then only you will get strong. Né? Yes, Nasra. Yes, Nasra, you can start.
Yes, Mr. Alex, I understand changing medications can be very difficult and stressful because you have been taking this medication or medications for a while. So I want you to be reassured. I want you to be understanding. I will be here to make it easy for you. I will be helping you until you are very confident. So just relax and trust it will be successful and you will learn effectively.
Yes. That's very nice, Nasra. It was a good attempt. Thank you. Next, Ashley.
Mr. Alex, I know that you are suffering with diabetes from long time. Currently, you are so anxious and worried about your condition because it is uncontrollable. I will explain to you how to self-administer insulin so that it helps you to control insulin levels in your blood.
That's fine. That's fine. Really fine. Yeah.
Thank you, sir.
I'm giving 30 seconds. Anybody is interested, you can start. You can write your name or raise your hand. So remaining students, third point is here. Yeah, Binsimol Thomas. Yes, you can start. Others write the third point. Reassure patient about managing injections, clear instructions, easier with practice, stress importance of insulin injections, faster absorption into bloodstream, not broken down in stomach, more effective, etc. Yeah, Binsimol Thomas, you can start now, the previous one.
Mr. Alex, I am understanding that you have some kind of uncontrolled blood sugar and you have been taking oral medications for it. And this present scenario, your blood sugar is showing little high. So this insulin administration will be effective and this will give you some kind of speedy recovery. So I recommend you to take this insulin administration and definitely I will help you how to do I will help you and I will teach you how to take this insulin. And if you will take this, it would be really beneficial for you. And what more, sir? I'm not getting words.
No problem. It's okay. It's okay. It's okay. Yeah, next. Fine. Now all of you prepare the next question. Reassure patient about, I reassure you. Don't say just I reassure you. Give the words of reassurance. Okay. The word reassurance is not everything in itself. There is something more to that. Okay. There's something more to that. Yes. It's not a tedious process. It's very simple. And if you can manage taking insulin injection on a regular basis, you can manage your diabetes excellently well. If conditions permit, You can even get back to medication regimen once again. But as of now, I'm going to give you the instructions, and these are the instructions. And if you follow them, definitely you can control your blood sugar levels without any difficulty. Today, you may be alarmed because for the first time in your life, you are knowing something which you never thought of. So learn, and with practice, maybe within 4 or 5 days, you will be at ease or comfort, very comfortably. You can take injections, no doubt. There are a number of people who are in the same condition as you are in. They are able to manage this blood sugars well, their diabetes level excellently, taking the insulin injections properly. If so many are able to do that, why not you? So if you practice on a regular basis, as explained, of course, I'm going to monitor you for the first week. And only when you're comfortable, then I will stop guiding you. Then you can manage all by yourself. You need not come here. And now, this is extremely important because otherwise, you'll have a number of complications. To avoid such a situation and to keep yourself safe from the future possibilities or difficult situations, it is extremely necessary that you take injections. There is no better option. The doctor, having considered all the possible options, finally resorted to prescribing insulin injections. If there has been any chance of any other option, then definitely the doctor would have suggested. Trust me, I have seen a number of patients. They are taking these insulin injections on a daily basis, and they don't have any problem at all. And to give you an example, my uncle or my aunt, who is 45 years of 52 years of age, she's taking these insulin injections. I taught her. Within 3 or 4 days, she learned, and now she's, for so many years, she has been taking. So, if you are compliant with these insulin injections and follow the procedure and protocols, definitely, undeniably, or undoubtedly, or irrefutably, you can manage your condition well. And if you give me your consent, and I believe you will, if you give your consent, and the fact of the matter is, I believe that you will consent to this because ultimately it is your health that matters. And your health is of utmost importance. With your consent, I'm going to demonstrate the procedure. What do you say? He has to say yes. Yes, write down your sentences. So we are going into the third one, that is the middle of the session. 2 more questions are there. But before that, okay, I think you're writing, okay? Once you write or before you write, okay? After writing the next question, after the third question, give your comments. How smoothly or how beneficial is the session? How beneficial do you think is the session? Is the ongoing session? So, how beneficial do you think is the ongoing session? Give your valuable comments. Okay? Yeah. Nobody can be a master overnight. Yes, Rubina, you can go ahead.
Good evening, sir. Sir, I will answer the same question.
Yes, carry on.
Okay, sir. It is extremely important to avoid complication. You need to focus on it because it will control your blood sugar and keep you more confident. You need it on daily basis and you need to come to hospital daily. If you if you follow the procedure, you will manage your condition at home in your comfort zone. It is much more important to live healthy life. Are you getting my point?
Yes, that's fine. Yeah, anybody else? Come on, write down your sentences. Yeah, Rubina, you can write this, whatever you have spoken, this question also you can write.
Okay, sir. Thank you, sir.
Yes, please, all of you type your answers. Type your answers and respond to the questions. Rojia Sharif, Nasra, very good. Nasra, insulin injections are more safe, are safer. There is nothing called more safe. They are safer. Okay, no problem. You have written very nicely. I'll correct them. What about the others? Silent spectators. Insulin injections are safer, more effective, and faster for controlling your blood sugar levels. I'm here to help and repeat the demonstration until you're very confident and comfortable. I want you to just relax. I want you to just relax. How does it sound? Good. One question mark is enough. I completely understand your anxiety. No need to worry. I am here to help you. Let me tell you why we Yes, next. Wow, this awesome, Smita Kanta. Yes, the students who are on the YouTube and those who are on the Telegram and everywhere. We have a batch coming up for speaking. We're going to start the course from the 1st of December. So if anyone is interested, get back to me. You can message me on my WhatsApp, or you have all the details, telephone, anywhere. You can just message me on the YouTube, Telegram, Instagram, Facebook, anywhere. So you know me by my name, Grandmaster, 1 or 2 or 3, or Peter Simon. And just message me. We are going to take some students for New Year. Sorry, for December. So there's a batch for speaking. There's a batch for writing. And there's a batch for all the 4 skills together. And if anybody is interested, you can join for reading and listening, either separate or together. Yes. As you can see that your blood sugar levels are unmanageable, with the tablets, and high blood sugar can cause many complications to you, like retinopathy, neuropathy, and so on. However, if you take insulin injections on a daily basis, basis is singular, basis is plural, on a daily basis, it will help you, they will help you. Insulin injections, plural, they will help you to manage your sugar levels. Apart from that, I will check your confidence level for self-administration of insulin. Until you gain the confidence, I will help you with the administration of the injection. Does that sound good to you? That's fine. Sangeeta Patel. I know it's quite difficult for you, but let me assure you, it's a very simple procedure. It's beneficial. It's beneficial to control your sugar levels. Before proceeding further, would you like to ask any question? Would you like to ask anything? Please let me know. Ashley, I am going to help you how to self-administer insulin injections. Don't worry, B is not needed. Nowadays, so many people are self-administering insulin injections. They are safe, easier to absorb into your body. I completely understand, Rosia. I completely understand your anxiety. No need to worry. I'm here to help you. Let me tell you why we chose injections for you. There are two types of diabetic patients. You belong to the second group, type 2 diabetes mellitus, which needs insulin injections. That means your liver is not excreting the required amount of insulin. And I will make it easy for you to inject yourself. Are you getting me? Anybody is ready for speaking? Raise your hand or type your name or say, I'm ready. I'm here to listening all your concerns because I know how important the administration of insulin injections are to control blood sugar levels. Good. Vinci more. Insulin injections are more effective and safer to manage your blood sugar levels. I can understand your worries. With proper explanation, you will be able to cope with the situation. Good. Cope with, you did not say cope up with. Cope up with is wrong. Many people use that style. It's wrong. There is nothing called cope up. Cope with means manage. Okay. With proper explanation, you'll be able to cope with the situation. By regular daily practice, you can become confident in administration. Are you able to follow? Are you following? Okay. Blessings. Administration of insulin injections is more easier to do. Administration is more. So not or more. Injections are more, but administration is more. More is not required because easier is there. Easy, easier. So more is not required, blessing. Administration of insulin injections is easier to do, easier to manage than any other injections. So don't be worried about them. Insulin injections, them. I'm here to help you. Instead of help, you can say support you and demonstrate the method, the process of self-administration of insulin injections. Is that all right for you? I am here to listening all of your concerns because I know how important administration of insulin injections is to control blood sugar levels. We are an expert team with the best knowledge and training for educating you. Okay, that's good. Yeah, anybody ready to speak? Raise your hand. Right. Next, we'll move on to the fourth point. Emphasize injections are best possible option available. Current manager not working. Explain injection, giving process, washing, drying hands, pinching skin, insertion of needle, 45 to 90 degrees. Angle, leaving in place 5 to 10 seconds, etc. Describe need to rotate injection site, preventing formation of lumps, risk of less insulin absorption, etc. Yeah, prepare your answers. Fourth point. Rubina, it's extremely important to avoid complications. You need to focus on it because it will control your blood sugar and feel you more and make you confident. You need on a daily basis, you need to check it. But if you don't know, you will be dependent on others. It's so simple procedure. If you follow the instructions, you will be able to manage and control your blood sugar levels at home in comfort zone. It is your right to lead instead of live, you can say lead a healthier lifestyle, life, yeah, whatever, that's fine. Next. If anybody is ready to speak also, you're ready. Three-point pushes. 3-point pushes. Okay, Ushas. Yeah. You can speak. So do you
Hello.
want? Yes, please.
Third-
Tell me what you wanted.
yeah.
3-point pushes.
Means a third
What
point
the
I will
points?
include. A third task also I will include.
Point number 3. Okay. Come on. Come on.
Okay. I understand your anxiety about it's nothing much be worried about managing insulin injection. I will give you clear instruction for self-administration procedure and it's easier with daily practice. As you know, you have been diabetic for long time and the sugar level is not managed with controlling diet and the oral medication. It is important is to control your blood sugar normal. It is faster absorption into bloodstreams. Insulin is not broken down in stomach and more effective. Then I can emphasize you injections are the best options is available, and to the current your blood sugar was high, so that is better to manage in the fast, and it is not going any other complication. And let me explain to the injections how to give the procedure. First of thing, firstly we have to wash and dry our hands, then to pinch, then we have to decide that there is a 3 side is there, we have to choose it the side and pinch in the skin. Then as usual, how much dose you need to introduce, we have to take in the syringe, then insert the needle 45 to 90 degree angle, then leave this place 5 to 10 seconds. 10 seconds. I think you can understand about my points. Then I can tell you one more thing. No need to rotate injection site, but it means the preventing information of lumps and to avoid the risk of less insulin absorption.
Fine, very good.
Thank you.
Next. Anybody else? Tricia, I understand as you're not interested to take injections, but I want to tell you that this is the best method to control your sugar levels, as the rest of the methods are not so efficient. Method is not working. You have to change your style a little. Okay, Tricia. Next, Reena Chauhan. I will advise SE, not CA. I will advise some effective strategies that will help for self-administration of insulin Am I clear? First of all, you have to clean the area with the help of an alcohol swab, Then you have to prepare the dose. After that, you will need to insert the needle and push slowly. Lastly, remove the needle and discard safely. You will follow my advice. You will cope with, very good, the situation after a few days. Can you do that? That's fine. That's fine. Yeah, next, who wants to speak? Who wants to speak next? Nasra, yeah, Nasra, start.
I understand that sometimes the needles are scary, but in your situation, I understand it is fearful and somehow you see it difficult, but you will cope with it. And I want to tell you this is the best option available for you and for your health situation. So I will be explaining to you and demonstrating the process of self-injection needle. Injection insulin. First, you need to wash your hands and dry it. Then you have to pinch the skin, the area where you are taking the injection. Then insert the needle into 45 to 90 degrees. Then you leave the area 10 to 10 seconds. Then you need to rotate you need also to, you don't forget to rotate the place each time you take it in different place, and because the skin you may develop some side effect of forming lumps or skin hardening, so you need to take every time different place. And I will be demonstrating and giving to you and supporting you until you are very confident. So don't worry, I'm here until you are confident. I will be helping you.
Right, that's very fine. Yeah, next. So anybody else? Yeah, Reena Chauhan. Larai, wonderful, amazing, marvelous, awesome. Yeah, Reena Chauhan.
Yes, sir.
Yes.
I will advise some effective strategies that which help of self-administration insulin injection. Am I clear? First of all, you have cleaned the area with the help of alcohol swab. Then you have prepared dose, and after that you will need insert the needle and then push the slowly. Lastly, remove the needle and discard safely. And you will rotate the side of the site of injection. And if you will follow my advice, you will cope with the situation after a few days. And can you do that? Thank you, sir.
Yes, very good. Actually, you're stressing on the letter D. Advice like that. Advice. Advice. D should not be stressed.
Online.
Advice. Okay.
Okay,
So little soft. Okay.
sir.
Right. Right. You're doing fine. That's good. Larai, I really appreciate you. Have given a lot of information. Yeah. So anybody else? Anybody else? Anybody else? Yeah. So who is this? Right. Tricia. Yeah, Tricia. Yes, please.
Sir, I just wanted to know, like, if I say about injections, can I continue saying about how to demonstrate it? First, I am just telling the patient about his or her fear. And then
Okay.
immediately, I think I can't start saying how to demonstrate it. So I should
No.
keep something over there to continue my conversation.
Yes,
This is
that is the talent. You're right, you're right. So that is the talent, how you are connecting these two things. When you see, for example, a small child also, he knows who will listen to his request. He will not go to the father and say, Daddy, give me a chocolate. He will go to mother and tell, Mama, I want a chocolate. So mother will give. So how to deal with the situation is in the hands. Small children also are very clever, correct? Yes or no?
yes, sir.
So you have to manipulate that in such a way that the patient will listen to you. It should be in a convincing presentation. See, for example, the way how I am talking will not allow you to say anything, but you say, yes, sir, like that. So that is the way how you have to. See, when I said that small children also know how to deal with the problematic situation. They want something, they know who is vulnerable. So father will not give, so he will never approach father. Even if he wants from father, he will go and hide behind the mother and make mother ask for him. So that is the way. So they know the tactic, they know the technique. That is called the skill of presentation. So in the same way, you also should interweave the condition into such a way that the patients will say, yes. You understand my point?
Yes, sir.
So
So
that's-
I
see how
can
you
say
get into
like,
this.
I understand as you're not interested to take injections, but I want to tell you that this is the best method to control your sugar level, as rest of the method is not uh,
So
coping.
don't say, I understand that you are not interested to take the medications.
Means fear.
Don't say that I understand that you are not interested. That means you are against him now.
Okay.
Directly you are going to provoke him and you are going to make him upset.
Oh,
I
okay.
totally agree with your concern.
Okay.
And I value your reason for not taking the insulin injections. But let me give a clarification. You got the point now how I have changed
Yes, sir.
it.
Yes, sir. Yes, sir.
Be diplomatic and present it in a qualitative way. I absolutely agree with your concerns regarding not taking insulin injections. You have your reasons for that, and I appreciate. But what you do not know is you have no other option but to take insulin injections, because all the other options are ruled out because they are not going to help you in any way. Only after having considered all the possible options, the general practitioner has advised you or suggested you these insulin injections.
Yes, sir. Thank you, sir. And after that, I can ask.
Despite your personal despite your personal feelings and interest regarding this matter, there is no other option left like that you have. Okay?
Okay, sir. So
Right.
if I switch on to this another like how to give injection, so whether I can say like that, can I tell you?
According to the situation, there you can make the patient speak also. It's not that continuously you have to speak everything.
Yes, exactly, sir.
Here we don't have much time, na? Here
Yes, sir.
I alone cannot speak with you all those things. I'm just giving you your style of making all the points. That's all. I'm making you
Yes.
speak here. But in the real situation, everything changes, right?
Yes, sir.
You can make
So,
it into 2 parts or 3 parts also according to the situation in the real show.
so I think I can ask like this. So can I tell you how to, can I demonstrate you how to give yourself insulin
Then give
injection?
them no. If you say, can I demonstrate you? If I am there, I will say, no, I don't want you to demonstrate me because I don't even want to take the insulin injections.
Okay.
So what you will do? That is what I'm saying, be diplomatic.
So there is a very easy method to give your own self insulin injection. Can I show you how to give yourself insulin injection?
With your kind permission, I am going to show you that. Already taking it for granted.
Okay.
If you say, can I show you? Then I will say, don't want.
Okay.
With your kind permission.
Permission. Yes, sir.
So politely.
Okay. So
Okay.
with your kind permission, can I show you? Can
I am
I?
going to show you. I am going to show you.
Okay. I am going to show you how to give yourself insulin injection.
That's fine. That's fine. You can write afterwards. I can correct and I can give you.
Yes, sir.
Okay.
Yes.
We are moving to the next question.
Thank you.
Welcome. So here you are.
Where is it?
So the next last point, all of you, explain the importance of safe needle disposals, suitable containers, proper care and handling. If you are making this patient speak much, you will lose your ground. You should speak 75% of the time and the patient should speak 25% of the time. That means you are going to speak, say, 75 to 80%, and patient is going to speak only 25 to 20%. Then only you will go to get a good A grade. If everything you are asking and patient is answering, then there is no benefit for you. 80%, 75 to 80%, your speaking time should be there. Okay, fine. That's what you have to control. Then yeah, every time you're asking one sentence and asking, what do you think? Okay, yeah. How does that sound? Yeah, very fine. What do you do? Every time you're asking question and the patient asking question, patient. That means you are an ordinary person, very ordinary person, and you will not pass the exam only. Okay. So last question. Outline insulin storage, refrigerating unopened insulin, not exposing to sunlight, high temperatures, checking expiration dates. We are going to close in another 10 minutes. Fast, please. I have a session. Yeah, write down your points. Hi, I want to be added in special group for doctors. Dr. Simon. 83 bucks. Yes, please. Last 5 minutes for you to, and we'll close in 10 minutes. Somebody's mic is on, please mute it back. Larai, do you want to speak anything? Yes. It was a very fruitful session. I really appreciate it. Larab, I did not expect that you write so nicely. Very good. I really appreciate. If you attend the sessions every day, definitely in the first go you will pass, no doubt. Yes. So let me read the rights. Know your blood sugar now, not no. Now your blood sugar levels are not controlled with the oral medications. So that's why you must take the insulin injections, because it will, no, they will control your blood sugar levels. Now I'll explain you the whole process of insulin administration. First of all, you will wash your hands and keep dry. After then, clean the skin with alcohol swab. Whose skin? Your skin or his skin? Okay, right. Should be little clear. Then, like a pinch, hold the skin like a pinch, and then insert the needle onto 45 to 90-degree needle angle, and you need to keep the syringe until 5 to 10 seconds. Another thing, you must remember that you should change the site of insulin injections, because always use the same site will affect the insulin absorption. This technique also prevents you from lumps. Okay. Yes, type your answers, please. Last 3 minutes. Nasra, yeah, Nasra, you can speak. Yes, Nasra, Muhammad.
So I will explain to you the importance of safe practice needle disposal. You have to maintain with you a sharp box where you need to dispose the needle after each injection. Also, you need to keep your insulin in the refrigerator away from the sunlight and the hot weather. And you need to check the expiration date of your all new insulin. Also, I would like to, if you don't mind, I would like to observe you while you are taking the injection by yourself to make sure you are confident and you can take it safely.
Yes, very good. Very good. Next, anybody else? All of you write your answers. And if anybody is finished writing all the answers, give us more feedback of how did you like the session? Was it beneficial for you? What new things did you learn today? And rate the session. Ushas, yes, go ahead.
Hello.
Yes, please.
Yes. First of all, I would like to explain you about the importance of safe needle disposable after the insulin administration. If you can collect all needles in a suitable container, then you have to take proper care and handling. Let me explain about the safe storage of insulin in the refrigerator. Do not expose to sunlight or high temperature. Please make sure expiry date before administration insulin dose, and then I can let me know dose, and then let me know, are you willing to be observe self injection?
Good. Good.
Okay, sir.
Yeah, next, Reena
Thank you.
Chowk. So those who have finished all the points, you just type some feedback into the chat box in 2 or 3 sentences. How was the session? Grade your session. Then what benefits you got, and how are you benefited? Reena Chauhan, next. Yes, Reena Chauhan.
Yes, sir.
Yes, start.
I strongly advise to you how to manage dispose the needle and then disposal the needle. First of all, you will needle after the insulin administration. For that, you can collect all needle in a container, and next you should store the insulin injections in refrigerator and protect you from sunlight. After that, next you should keep in mind about expiry date. In if you can you following my advice?
Yeah, that's good.
Thank you.
That's good. So remember, when I say good means that is good, okay, it's better, far better, but you can still improve a lot. So fine.
Thank you.
Anybody else? Smita Kanta, yes, Smita.
Yes, sir. So now come to the safe disposal of needles and storage of insulin. First of all, you should never recap the needle and always discard in the puncture-proof container to prevent yourself to prick from the needle and also from any kind of the infection. And secondly, you should always make sure before taking injection you have to check your expiry date and the color of the insulin. And please store your insulin in the refrigerator to protect from sunlight and protect from the high temperature. Hope you have enough knowledge regarding taking of the self administration of injection and how to dispose your injection needles and how to what you should do after taking the injection. So hope I have cleared your doubts so far.
Yes, that's very nice. So, Rubina. Yes, Rubina. Rubina. Last. Yeah, all of you, write down your comments. We are going to close the session in 2 minutes. Yeah.
With your
Yes,
kind
please.
regards, I'm going to I'm going to explain you that how you will uh, arrange your insulin injection in the refrigerator, because it is harmful if you expose to the sunlight. Its color will change, and it will not able to use for the next turn. So better do not expose to the sunlight and keep in the refrigerator. Uh, One more thing I need to explain you, that before going to use, you have to look at the expiry date, because it's written on the insulin that you can use after opening. You can use within the time limit, and you can uh, uh,
Yes, that's fine. So we are closing the session, winding it up. So if anybody is there to write anything, you can just write down 1 minute, last minute. Yeah. Last minute. Last 1 minute. And what all these sentences everyone has written, I'll put it in the Telegram channel and I'll put it in the WhatsApp group. I'll make PDF of this one and I'll write everything. So you can take them. And yeah, so any students who are really serious, or doctors or nurses or physiotherapists, if you are interested for the regular daily sessions, individual sessions, so you can just contact me for admission. Those who are watching on the YouTube, you can get my number from Telegram channel and YouTube also. You can just type there on the YouTube and you'll be responded. Yes, 12, 11, countdown started. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1, and done. So first speaking for nurses. New folder. Nurses. So interactive session. Insulin injections. Okay, nursing. Insulin injections. Just to one. Yes, I'm going to post this PDF, the Telegram channel. This is just practice. New word. So original chant without corrections. Original chant, conversations without corrections. So I'll post it. I'll post it and I'll give you the link. You download from there. File, save as PDF. So this is our session. What all everyone has written, it is here. So file header and watermark. File save. File exported to images JPG. So I'm giving images also, I'm giving PDF also, I'm giving, yes. So I'm posting them here. And if you want the complete PDF, it is here. As a PDF if you want, you can take it from here. The link I am going to say here. You can just download straight away. So this is the link. So good night. One and all. Right, see you.